I'm Tom Potakar. I'm a consultant plastic surgeon at the Welsh Centre for Burns and Plastic Surgery, and I'm also the director of Interburns. Interburns is the international network for training, education and research in burns, and this is an organisation that I set up with colleagues from India and Pakistan back in 2006. The initial aim of the organisation was really to bring together like-minded people from around the globe who are motivated and dedicated towards improving burn care in poorer countries of the world. Currently there's a huge discrepancy between the incidence and also the outcomes from burn injuries in rich countries and poor countries, and well over 95% of burn injuries occur in poorer countries where access to good care is very difficult. There's very limited training and there's limited resources to deal with burn injuries. So we set up this organisation and subsequently registered as a charity, and now we have a network of partners throughout Africa and Asia, mostly involved with undertaking education and training for all members of the burns team, so not just surgeons but general doctors, nurses, therapists and other healthcare workers. Burns has been described by the World Health Organization as one of the great neglected public health issues. There's been a huge emphasis over the last 20 to 30 years on infectious diseases and on maternal and child health, which is obviously very good, but at the same time burns has been neglected and are in fact responsible for a huge number of deaths every year. Nobody really knows the true figures. We do know that at least 300,000 people die from purely fire burns every year, but that's a massive underestimate, even by the World Health Organization's own understanding, a massive underestimate. In India, for example, the commonest form of death for women between the ages of 15 and 30 has been ascribed to burn injuries, and that was in an article written in The Lancet several years ago. Perhaps the most tragic examples with the burns is the children, because paediatric burns account for about 70% of injuries, and because children are still growing, they are much more susceptible to developing contractures and severe deformities. So even a minor burn, if not treated appropriately, can lead to lifelong suffering, not just physical but psychological suffering and social suffering as well. These burns are preventable in the majority of cases, although prevention is notoriously difficult, and it must be remembered that burns are an injury associated very much, so alleviating poverty will help alleviate burns. Even those that can't be prevented, the complications of these burn injuries can in general be prevented. So we're very fortunate in rich countries now, in Western developed nations, we very rarely see severe contractures in burn injured patients, whereas these are all too common throughout Africa, Asia, Latin America, where even minor burns can lead to very significant complications. The best way of preventing these is using really quite simple techniques that don't cost a lot of money. They're not particularly time intensive, and one thing that Interburns tries to stress is the possibility for making really significant improvements in burn care that aren't going to require huge resources and can be done quite cheaply. What is required is a motivated burns team, so we spend a lot of our time trying to build and develop motivated burns teams to address these problems.